Hello, everyone, and welcome to the Health Channel, all health, all the time. I'm Andrew Schmertz, and this hour I'm joined by two of Baptist Health Care and Counseling psychotherapists, Grace Jimenez and Amy Exum. Depression is said to be increasing in young adults, and with recent mass shootings, this topic keeps making headlines. An average of 17% of young people experience an emotional, mental, or behavioral disorder. And 50% of adult mental health disorders start by the age of 14, 3/4 by the age of 24. Grace and Amy, thank you for joining us today. Such an important topic right now. Let's start, Grace, if you could tell us a little bit about what depression looks like in a teenager and how it's different than in an adult.
Well, with teenagers, what we're looking at, sometimes what you see is more irritability. And I know a lot of parents will tell me, but what's different between depression, irritability, and moodiness? And what we're looking at when we're looking at irritability for somebody who's depressed is there's a lot more snappiness. There's a lot more irritability all the time. When you have moodiness, you have periods where the person is happy, where they're sad, where they're excited about things. When you have irritability because a teenager or an adolescent is depressed, you're looking at more of that snappiness. It's more consistently, it's across all of their life activities. It's happening at home, it's happening at school. They're isolating more. So where they used to enjoy going to soccer, or maybe they used to enjoy going to dance class, all of a sudden they don't want to do that anymore. All of a sudden what they want to do is talk a little bit more, or not talk, but be on their computer or be at home.
Correct.
Completely isolating themselves. Yeah.
Amy, why do you think we're seeing an increase in depression? Is it simply that more people are seeking help, or are there real societal issues that are causing this?
I think it's a combination of both, right? We have a 24/7 hour lifestyle where we have access to our phones, to social media. We're expected to be going all the time and performing all the time. And then in addition to that, you know, I think the stigma is being reduced a lot, so more people are reaching out for help. But there's just so many expectations that are out there for not just adults, but for young adults. When, you know, I go and speak to parents, I let them know, you know, a lot of times people think, well, what do my kids have to be stressed about? They get food, they go to a great school, they have clothes, they're taken care of, but there's also this, what's my presence on social media?
Yep.
How am I doing in school?
They're also overloading their kids' schedules, aren't there? We're seeing kids, you know, there's school, then there's soccer practice, then there's dance recitals. It is a constant schedule of events, I feel like, for many parents and their children, because many parents probably feel they have to give their kids this opportunity, as well as be away from their kids because of work pressures.
Right. Yeah, what we're seeing is kids are up at 6, 7 a.m. They rush to school. They're rushing through their day at school. Then right after school, they have to rush to some kind of activity. And it's not one day, it's 2 or 3 days. And we're looking at, by the time they get home, it's about 6 o'clock. Around that time, they're starting dinner, they have to take showers, they still have to do homework, and they're not getting into bed until like 9 or 10, sometimes 11 or 12, and then to start all over the very next day. And a lot of parents think, well, it's normal, it's what they have to do. But it doesn't have to be that way. And the more packed your schedule is, the less downtime you have, the harder it is for you to recover, the harder it is for you to feel a little bit more stable.
The issue of depression and suicide have reached mainstream entertainment programs. The popular Netflix series 13 Reasons Why has parents and teachers having conversations with teens about suicide. 13 Reasons Why depicts a story about a teenage girl who killed herself and left 13 audio notes for her friends about why she did it. Just recently, Baptist Health had an expert panel on the Netflix series. Let's take a look.
The series 13 Reasons Why has opened up dialogue for the first time I've seen in quite a while between children and their parents, as well as counselors, administrators. It does bring some concerns along with it, such as an actual suicide within the series. And many problems that children are exposed to also are detailed in very vivid fashion. So we have really expressed to our schools, to our administrators, and who have contact with parents, if they are going to have this shown within their home, please watch it with your adolescent. Open that opportunity for dialogue. Discuss what the concerns are, and more importantly, discuss how it's preventable and where help can be located.
Parents don't allow kids to talk. They shut them down, and they don't even mean to. I do it, and I don't even realize it with my own kids. So, opening the conversation about, so tell me what's going on at school, and then listen to them. Don't automatically go to the next conversation you want to have with them. How's your homework? How's your grades? You've got to let your kids talk. The best thing you can do as a parent is to be involved with your kids.
For any parents or kids that might see this and have a child that they think may be struggling with just the social pressures out there, it's just letting them know that they love them unconditionally and are not here to judge them, letting them know that there's hope, that there is help out there, that they can move past whatever it is that they're going through, and life can get better.
13 Reasons Why was quite controversial. Many people considered it a glorification of suicide. You've seen parts of it. What do you think?
I think it's more importantly to look at the fact that it's bringing it out to the forefront, that people can actually talk about this, where in the old days we didn't talk about this at all. It was hidden, and allowing us the opportunity to talk with each other and to talk to our kids about it gives us a power that we didn't have before. So I think it actually helps us have that conversation.
And when once depression was very much in the shadows, people didn't talk about it. More and more celebrities are talking about it. Mariah Carey has talked about it. Dwayne "The Rock" Johnson has talked about it. Right. When teenagers see celebrities talk about it, does that make them feel like they have a path to success and that they're more open to getting help?
I think it becomes much more socially acceptable to be able to talk about. Part of mental health issues is that people feel alone in it. I don't feel comfortable, sharing this with other people. And when we see, successful people come out, it does give us hope and light that, hey, there's another option out there. Again, it's still a talking point because sometimes I hear now that it's really popular to go around and tell your peers, hey, I'm depressed, I'm seeing a counselor, this is a cool thing. So there's a catch, and it's all about that discussion that Grace was talking about, the pros and the cons. What can I do to, help you in having this discussion, be more open about it?
There's a difference between clinical depression and sort of the run-of-the-mill depression of feeling blue, correct?
Yes.
And you have to be able to diagnose that because there's different treatment options.
Yes. Yeah, so when we're talking about everyday depression, I think we use that word very loosely in our society. I'm feeling depressed today. Oh, so-and-so was feeling depressed. But when we're talking about clinical depression, we're looking at having to meet a certain criteria. So for us in the mental health world, we're looking at how long has it been happening. So if it's happening for 2 whole solid weeks and then a little bit more. If it's happening on a daily basis, every day, most day, or all day long. Those are some of the things we're looking at. We're looking at having that depressed mood all the time, or losing interest in the things that you normally like to do. So if you normally like to do crafts, or you normally like to spend time with your friends, and all of a sudden you don't want to do any of that, that plays a role in our diagnosis. We look at things like your sleep. Has your sleep pattern changed? Has your weight changed? Are you eating more or eating less?
Physical symptoms too.
Yes.
There are physical symptoms that kind of manifest itself, stomach aches, feeling nauseous.
Especially with children, and children might manifest more the stomach aches because they don't have the verbiage or the vocabulary to be able to express that I feel nervous or I don't feel well, so it will manifest in those other
When
ways.
a teen comes into your office, what are some of the things you'll ask that teen?
I think the first thing is just to create a relationship and find out, what's going on. What do you want to talk about? Because if I go in with an agenda, which most parents do, I'm only going to find out what I want to know, and I may not be able to find out what is really bothering them. So I'm just going to ask them about what's going on in everyday life. How are you doing? What's going on with school? What are your interests in? If I go in with agenda, it becomes really difficult to be able to find out what I need to know. I want them to share with me what's bothering them.
And if their parents...
I wanted to add, if I may, that we need to find out a little bit about what was going on before. So we want to know about their whole personality. Before they came to see us. Before the parents had some concerns about something. Because if their personality started to change, those are some of the things you want to look at. Any kind of change in their personality. So if they're a very outgoing child and all of a sudden they're quiet, you want to look at that. If they liked certain activities but now they just don't want to do anything. If they were sweet and kind and all of a sudden they're irritable, you look at those things, and we want to look at what caused those changes. We want to ask about what was going on at the time that those things started to change. Was there a change in school? Was there a change in grade? Was maybe one of their friends moved away? Maybe their pet passed away? Maybe somebody else in the family did? So you want to ask questions about the timeline of when the symptoms started to rise.
Okay, we're talking about teens, depression, and anxiety today. Take a look at our website, allhealthallthetime.com. When we come back, we'll learn more about some of the stress and anxiety teenagers suffer before they go to college. We'll be right back here on the Health Channel.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation. Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer. Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with, it's different from a man and from a child. So there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty. And if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, all health all the time. I'm Andrew Schmertz. I'm here with two of Baptist Healthcare and Counseling psychotherapists, Grace Jimenez and Amy Exum. College can be overwhelming for teens and the transition is stressful. Did you know about 80% of college students experience stress? I'm surprised it's not 100%. And about 13% of college students have been diagnosed with depression, anxiety, or a mental health condition. The good news is there are a few things they can do to help out. Let's take a look.
So things that recent graduates can do to alleviate anxiety about going to college is start to expose themselves to some of the changes. So some of the things that they can do is they can visit, if possible, the campus, walk around, talk to some of the students there, get some advice and hear from them like what college life is like. And as they start to get exposed to what college life is like and that unknown starts to become known, the anxiety starts to decrease. So one of the most important things that parents can do to relieve their own anxiety is talk to their children. Parents are surprised how much children actually listen to the advice that parents give. As parents listen to their children and hear, that they do have a plan for college, they do know what they're doing, that can also help relieve their own anxiety about them going away or about them starting college. Then letting them go to live their college life. As schoolwork starts to pile up, sleep is extremely important. So a lot of college students fall into the habit that they want to study all night and they don't get sleep. That is the worst thing that they can do. Making time to make sure that they are getting enough studying in, but it's not creeping into their sleeping or their eating. Having a healthy diet and sleep are very important. Also, they want to make sure they don't get involved in a million clubs all in the first semester. Take the first semester, the second semester to get used to and accustomed to life now in college, especially if they're away. Do things that isn't just for school, but also things that they enjoy, things that can help them relax so that they're not going crazy as the schoolwork starts piling up. So what I've seen happen a lot in my experience working with college students is that parents tend to become helicopter parents. Parents want to be able to give their children times to be college students, to find that independence that they're looking for now that they're adults that they need. Calling every day should not happen. Wait 3 to 4 days and then check in with the child. And I would recommend finding out how they're doing, not just asking how are your grades. Are you passing your classes? No, ask them about them, how their day is, how their experience in college is, and having that open communication, but then also giving their child the opportunity to reach out to them. So encourage, your child to come back home. Weekend visits are possible, or them going and visiting for a weekend. I would always tell parents to first talk to their child and see, what they would want and what they would be okay with, but planning trips where they, are still seeing each other. I would not recommend semesters off unless absolutely necessary because they need to get used to life away from home if they're going to be in college away from home. But there's, nothing wrong with doing, mini trips either up to where their child is or the child coming home during the breaks to spend some time there with the family and talking to them, from time to time just to kind of, help them hear that, their family is still there.
A lot going on when a college kid goes off to college for the first time. There's a difference between depression and anxiety. This is where some of the anxiety may kick in. What are the main signs to look for when your kid rather, is going off to college and may feel really stressed and anxious? Amy?
Well, there's a couple different things that you can look for. One is, again, looking at those behavior changes that Grace was mentioning before. Is anything different happening? Having that conversation with them. How are you feeling?
That's a really good phrase. How are you feeling? And
Yes.
not saying, how are your grades? You're going to class.
Yes.
You're getting sleep. How are you feeling?
And I also want to mention too that, especially with parents in the segment before, they're talking about, how do parents cope with anxiety and stress of their kids going off to college? Having that open conversation is so important, because a lot of times we can transfer or pass on our anxiety to other people. Fear can be very contagious.
So maybe the parent is anxious and the kid is happy as can be that they're going to be out of the house.
Right, exactly.
What are you talking about, Mom? I'm fine.
Exactly, yes. And it's an exciting period of time too. So there can be a lot of confusion, because it's, I'm supposed to be so excited because I'm going away, I'm going to school, I'm moving on, yet I have these worries and all my other friends look so excited.
I would say that parents have those mixed feelings as well, because they're excited. Their child is going away, and look, you did something great. You got them to graduate high school, you got them accepted in a college, in a good college, and they're going away. They've shown you that independence where they can do that. Those are great things to be proud of. But then there's the anxiety, because you're not going to be there, and who's going to watch out for them and who's going to help them.
What about a kid who has been depressed in high school and treated for depression, and maybe successfully treated? What risk do they face now that they're going to be outside of what had been their safety nest?
Well, what you're looking at is, of course, when you have a lot of other pressures, and when you go to college, you got a whole new set of pressures. You have a whole new set of professors to deal with, a new style of teaching, a new style of grades, books, where you study, when you study, where you go, what you call your safe place. So a lot of those things start happening, and then they could start to feel some of the old depressive symptoms. What I would say is, when you're helping your child go away to college, talk to them about how they're going to catch it. What they can do. They know themselves. They know when they start to feel blue. They know the things that trigger it for
And maybe
themselves.
introduce them and the college to mental health counseling on campus, maybe that first
Absolutely,
week that they go in?
I would say
Definitely.
having a support system, especially if you're leaving the city, the state, do you have any family member or friends close by? Who would you reach out to if you did need support? That's going to be a key, because again, if I'm stuck in that isolation, I don't have a plan. I may just stay isolated rather than reaching out.
How often do you see kids who are very well adjusted in high school and have a great time, and they get to college and that's when the depression hits? Maybe they were super popular in high school and they're having trouble fitting in now.
Yeah, I've actually seen it quite often. I think one of the things that happens is that they're so comfortable with their friends, they've done well. Maybe they're the kind of student that does well in class, that studies but doesn't need a lot of extra studying, that does okay, that catches the styles of their professors and understands it, and they're doing well. But then they go to college and it's a whole new world, and they have to start to study in a new way. So maybe they were very confident before, and all of a sudden they have one or two little failures there, and they don't know how to bounce back from it because they didn't have that before.
It's also a totally different social environment.
Completely
There's
different.
a lot of pressure for going out late at night and drinking, and anybody who has some mental health issues can be pushed over the edge by that.
Absolutely. The exposure is incredible, and the drinking is a really easy way for that college students feel like they can loosen up. Everybody else is doing it. Wow, when I have a drink, it's so much easier to be able to talk to people. It's so much easier to be able to manage life, and then it can become out of control really quickly. We know a lot of college students end up binge drinking, and there's so many dangers that come along with it.
What about the flip side? When you have a kid who has had some depression in high school, and the parent says, I don't want to send my child away to school, but the child really wants to go, feels that that's a new opportunity. How do you have that conversation with the parent, and when do you know whether it's the right thing to do to give it a shot?
One of the things that we want to talk about with parents is, if you've helped them through the depression, if you've given them the tools, then there has to be a point where you can say, I'll be here for you. If this is the step you want to take, then I'll support you. And giving the child the understanding that they will always be there for them, whether they do really well or whether they have some challenges, that they'll be there. And that they can come home if they need to come home, that there is a support system out there. But the parent needs to know what the support system is. So when we talk about showing them around campus and showing them where the counseling center is and showing them who they can talk to, that's also not just for the child or the adolescent or the teen, but it's also for the parent, because it allows the parent the opportunity to know that their child can be okay and they will be able to seek out help if they need it.
And I think it's so important to be able to instill confidence in your children and adolescents and let them know too that if a mistake happens, it's no big deal. Failure is such a harsh word. It's thrown around, epic failure. I hear that from adolescents
and it's
all
hardly
the time.
Epic when
It's hardly epic, but it feels epic to them. That's the key.
We'll continue our conversation in a moment. When we come back, we'll have more on mental illnesses and some of the reasons why. Stay with us.
The AlterG can be used for everything from athletic population, from young kids, high school, college, professional athletes, all the way to our older populations coming in with hip replacements, knee replacements. When you get into the treadmill, they wear a special spandex pants that has a zipper on it. You zip them in. When we turn on the treadmill, it fills up with air. It goes through a little process where it kind of gauges how much the patient weighs. It starts you at 100%, and then from there, we bring them down at that point.
I run track and cross country at St. Brennan, and my knee, I started getting knee pain in January, so I stopped training and I started coming here. It's been good because I've been able to start running before I can actually get cleared, so it takes the weight off my body, so it doesn't hurt as much when I run, and I can start running and getting used to the motions and everything again before I can actually go out and train hard.
When the patient gets in it, usually they're always a little bit apprehensive, but in general, the patients usually like it a lot.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
There are some migraines that it looks like the nerves coming out of either the forehead or the back of the head gets caught or under pressure for some reason. We have identified that if you treat the compression, you can treat the migraine. So for us, it's very important. Patient selection is probably the most important thing on our end. Botox, because it relaxes the muscles around the nerves, seems to be a good bellwether of people who will respond to surgery. The best test is then to give a numbing medicine, an anesthetic block to those nerves while they have a headache. And if the headache goes away, then you have very good evidence that this is a nerve that can be treated. People who come in and say, my headache always starts, right above my left eye and it comes across my scalp and it's this throbbing sensation and it always starts the same way, happens to me multiple times a week, and then if you go and you numb that nerve up and the headache goes away, then you have very good evidence that this is a person who would probably benefit from surgery.
Thanks, Coach. Thanks for teaching me about teamwork and and leadership.
Thanks for showing me that sports help me stay healthy and do well in school.
And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day,
I want to be a teacher,
an astronaut, scientist,
or a coach, just like you.
Thank you for protecting my future.
Welcome back to the Health Channel, All Health All the Time. I'm Andrew Schmertz, and with me is our psychotherapist, Grace Jimenez, and Amy Exum. You know, mental illness is really in the news for a number of reasons. We had mentioned 13 Reasons Why, the Netflix TV show. Let's go back to that for a moment. That show covered a lot of different territory that sort of leads to a crisis for teenagers.
Yes. Yeah, one of the thing that they do really well in the show is they talked about the different topics that teenagers actually have to face throughout their everyday. And so some of them are, they talked a little bit about bullying, they talked about sexual harassment, they talked about rape, they talked about peer pressure. And I think one of the big things that also is noted in the show is how the adults around them didn't quite know how to address it or didn't address it as much as they should have.
Everybody failed this child, this teenager. One of the things that I thought the show also did a good job at are the victims left behind.
Yes.
Yes, you know, when we're looking at mental health issues, depression, anxiety, suicide, it's not just an individual issue, it's a family issue. And so if you think about all those people in the family that become affected, and it becomes a community issue
And their friends.
as well.
And
their friends,
and not just their friends, but people who did not know the woman particularly well.
Right.
In school.
Yes. So it doesn't necessarily have to be their immediate friends, people that they spend time with. It could be just somebody that was sitting in the classroom, or maybe wasn't even in the classroom with them, maybe was in a different classroom. And so what we're looking at is how it affects everyone. Because when you hear about somebody who's taken their life, when you hear about somebody who was hurt by somebody else, and this is how they responded, it affects, it triggers within each one of us a thought. It triggers like, wow, I can't believe that happened, or what would I have done, or what would I have done if I was that mom, or how do I feel if that was my best friend that did this or that was hurt? How do I help them? And so all these thoughts start going through our own heads, and it affects kids exactly the same way. And then it doesn't just affect high schoolers, but it affects the college group as well in a different way, because when you go away to college or when you're in a college, you're still seeing a lot of these things, and you don't always have the adults around as much. Because professors have larger classrooms, and there's a lot more.
There's less structure.
There's less structure.
And there's more independence.
Yes.
And being on your own and living with people as well.
Yes.
There's a totally different environment. Depression is the common cold of mental disorders. Here's how you know that you have it.
Hello, I'm Dr. Corin Menendez with Baptist Health Primary Care. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. You may no longer want to engage in normally enjoyable activities. Depression also creates a longer sense of frequent melancholy. If you feel you are in slow motion or you can't stay focused on an activity, these may also be signs of depression. Depression also causes people to feel tired all the time or the need to sleep too much. Contact your primary care physician if you are experiencing any of these symptoms to determine next steps.
Grace, in a broader sense, what is mental illness, and how do you so clearly diagnose it? There's no blood test for it.
No, there's not a diagnosis or a blood test for us. What we look at is the clinicians, the psychologists, the psychiatrists, the mental health counselors, marriage and family therapists, social workers. What we look at, what we talk about is, what are your experiences? What are some of the symptoms that are happening? We talk about what happened before. I was talking a little earlier about the timelines. Was there something that happened? Was it situational? Is it something that's been around for a long time? Has it been happening since childhood? And so what we're looking at when we talk about mental health, because we've moved away so much from the word illness from mental illness to mental health, because really mental illness has a stigma attached to it, a stigma that you're ill, there's something wrong with you, you're sick. That maybe like in the old days, back in like the 1800s, they talked about lunacy, and you had to be a lunatic. That's how we all think about it. You're crazy if you have a mental health issue, but it's not. It's really about taking care of yourself and self-care and making sure that your thoughts and your feelings and your behaviors are all in a good, positive way, helping you adjust to your everyday life.
And I just want to add, so, especially when we're talking about mental health, people are constantly thinking about, it's all about your thoughts. But we're also, just like Grace said, we're looking at behaviors. What are the behaviors? Because behaviors are a symptom of the mental health issue. So sometimes I don't understand why, my teenager just stays in the room. It's frustrating, it's annoying. Well, that's a sign, that's a symptom of a mental health. It can be a sign of a mental health issue, right?
What about educating people who need to identify mental health, not just school counselors, but for teenagers, the first line of defense, friends. They talk to friends. For adults, it's often spouses. How can we do a better job of saying to them how they can see the signs? Because often people miss it, or people don't get the signs, or people turn to outside sources to figure out what's going on. Do we need to do a better job in general about providing that education first?
Yes, I believe we all, myself included, need to slow down. Sometimes when I'm talking to my patients, I talk to them about, we mentioned earlier, physical symptoms. So what's going on with you? We tend to not do a good job of taking care of ourselves and focus so much on taking care of other people. Most of the time when I ask them, how are you doing? Their answer is good, great, fine, or okay, which aren't really feelings. We really need to take a moment to check in with ourselves and check in with other people.
Or you get the I'm hanging in there.
I'm hanging in there, but
hanging in there.
It'll
What
be
does that
okay.
mean?
And
it'll be okay.
Exactly. What does that mean?
And
but
because
it'll
you're
be
always
okay.
told it's going to be okay.
Right.
And that's not the right thing to say to someone who is suffering from mental illness.
Right, because they're so used to hearing that it'll be fine, you'll get over this, it's no big deal. But again, as I was mentioning before with the teens, it feels like a failure. It feels like a big deal to them in the moment. If you think back to when you were a teenager, your peers, your friends, how you did in school, that was your entire life.
Well, that's
There's
right. You don't
nothing
have any context. You think about these things that you made a huge deal about in high school, and you realize now nobody but you remembers them, and they weren't so big even back then. Can you tell us some patient success stories, kids who come in and clearly have some problems, and yet after a certain amount of time, and you could kind of tell us how much time that often is, I'm sure it's very individualized, their lives greatly improve?
The time it takes, it completely varies, because the people that we have come in, it can vary from not having clinical depression and just having some symptoms of it to an actual diagnosis. So that it's going to vary depending on the severity of the issue. But success stories, it's always really, it's always very. It brings me a lot of joy and my heart to see. Yeah, because part of it is just guidance. A lot of people just need guidance and support, and to have somebody who's really willing to listen to them for 45 minutes to an hour. I mean, we're usually not willing to listen to ourselves for 45 minutes to an hour. Our thoughts are going so fast. So when you have somebody sitting in front of you that says, listen, my time is devoted to you, it really means a lot to them, and they let you know that, and it brings a lot of joy.
All these mass shootings that we've recently seen have got to have an ongoing impact, not just for the kids involved, but for everybody involved at all schools.
Yeah.
What are you seeing? What are people telling you?
Immediately after the shootings, there's always a group of my patients that come in and want to talk about it. It has nothing, they don't know anybody who lives there, they didn't know the community, they just want to talk about how it impacted them, the fears that it now arises inside of them, the things that they're worried about, sending their own children to school or just going to the mall. There's so much that starts coming in, and that's where some of those anxious thoughts start coming in, where your brain just doesn't turn off because you're worried about something.
And anxiety is often fear and worries about things that will not happen, correct? And this is one of those things, but mass shootings are very real when you see them on television.
Oh, sorry, go ahead.
I was just going to say that anxiety, it's about things that will not happen, but it's all perspective. So if you're worried about it, you think it's possible for it to happen. So anxiety is about the things that could happen. And then for the person that's looking at it, they're so worried about this that they don't understand, they they're not able to take a step back and say, okay, just because it could happen doesn't mean it's going to happen. And it doesn't mean that I need to worry about it all the time.
And disengage from social media and
Yes.
television in general when these things happen. It's okay to watch the news, but don't watch it in 24-hour cycles.
Oh yeah, notifications on the phone, I mean, it can be constant. So absolutely creating some space to be able, and I wouldn't even say it's really disconnecting. I would actually say it's more about connecting with ourselves than disconnecting from everything else. We need downtime. And at 5 o'clock in the morning when you can check your phone, that's not really downtime. So whatever it is for your family, just a funny story. I was sitting and having dinner at a restaurant with my friend. I was looking at the table next to us. The couple were looking at their cell phone the entire time when they were eating, and so much so that they actually missed their mouth when they were when they were trying to eat, because they were just connected to the phone the entire time. So we really have to learn how to more connect with ourselves, give ourselves some space, because otherwise we can be bombarded constantly.
And when you have situations like after mass shootings, you have such high energy and everybody's so worried and there's so much everybody wants to talk about that it is important to take a break.
It becomes very crowded in your own brain.
Yes.
We're going to talk more about later coming up how you can relieve some of the stress and some of the tips to better mental health. Check out our website, allhealthallthetime.com. At that site, you can review what's information on this show and send questions to our doctors. We'll be right back.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with, it's different from a man and from a child. So there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers to different treatments and to the environment.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty. And if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
Welcome back to the Health Channel, all health, all the time. I'm Andrew Schmertz. I'm here with two of Baptist Healthcare and Counseling specialists, psychotherapist Grace Jimenez and Amy Exum. Everyone has bad days, right? And so you have to decide what's a bad day and what is depressed. And when I talk about bad days, something that could lead to depression is the continued, let's say, flow of difficulty at work or school. One bad day adds up, doesn't it?
It does. It does. So anybody can have a bad day. The problem that we see a lot of times is when your one bad day turns into one bad week, turns into one bad month, turns into one bad year. And your perception is it's been a horrible year and everything's happening to me, and why is this all happening to me?
Are we over-medicating our kids? Because I hear this from parents. They take their kid in and they're prescribed ADHD drugs for depression. They're prescribed, put on antidepressants right away. Is there too much of that going on?
It's a complicated answer, I think. The best way for me to answer that is just to say that it's important to see the right kind of physician, the right kind of psychotherapist. So, just because maybe not going to my primary care physician, but going to see a psychiatrist, making sure that I'm seeing somebody who is specialized or has seen individuals with attention deficit hyperactivity disorder. If I'm having family issues, I should go see somebody like Grace at Care and Counseling, who's a licensed mental health or licensed family therapist. So it's about finding that specialist, because even though we are able to treat anyone, we both have our specialties, and the same thing goes with physicians.
And sometimes it's not one size fits all. Sometimes there's a holistic approach. Some kids may need a little bit of medicine, but talk therapy is very powerful, isn't it?
It is. A lot of the research talks about giving the person who's depressed or anxious medication, whether it's a child or it's an adult, but it also talks about coupling that with psychotherapy. The research talks about how both together is where we see the better or the quicker improvements. One or the other by itself is not enough. But when we talk about are our kids over-medicated, I think one of the big things is if you notice that in your child, then go back to the physician that prescribed that, or find a different specialist and have the conversation with them and say, my child is zombie-like, so I think they're over-medicated. I want them to be able to act out more. I want them to show more excitement. Talk to them, because you're the expert on your child. You're the one that's with them all the time. You know their personality. So if you see a change, that's the time to go talk to the physician that prescribed this and have that conversation. Let's do something different. But also give them the tools. The medication is only one area of it. What they get in psychotherapy is the tools for them to manage whatever it is that's going on with them, whether it's depression, whether it's hyperactivity, whether it's having difficulty with attention, whether it's anxiety. We give them tools, and those tools are what then allow them to get off the medication, allow them to be able to function in life, in real life.
And self-realization is a big part of this. How does a teenager know if they are stressed or overstressed?
Right, I think that's a question that they all have, because I'm looking at my peers and they look okay. Am I stressed? I don't know. So that's, again, where really taking time to connect with yourself, having a conversation with family members or whoever they see as a support so that they can bounce ideas off of. Is this normal at my age? Is this something that you went through? Who can I talk to? Because it is very confusing. You have hormones changing. You're figuring out who you are. You may not be exactly like your parents. Maybe you like different things in them. But having somebody to bounce these questions off of is so important because it may or may not be. It just depends, and it's so individualized.
Stress releases powerful neurochemicals and hormones that prepare us for action to fight or flee. If we don't act, the stress response can create or worsen health problems. Dr. Juliette Vento tells us what we can do to help relieve stress and have a healthy mind.
In our daily lives, just the mere fact of change can lead to a stress in our bodies, and stress can negatively impact our health. The exact mechanism is not known, but thoughts are that a chronic low level of stress can lead to increased levels of stress hormones, like adrenaline and cortisol, which in turn can change or alter the way your blood clots and may in the future lead to heart attacks. In order to minimize stress, I have a few tips for you. Look at the stresses in your life, try to prioritize and apply time management skills. If you can't change the stress, at least change the way you react to it. There are many ways of coping with stress that will be considered healthy. Relaxation techniques, prayer, yoga are all things that you could use to lower the stress in your daily life. Exercise is known to release endorphins that will make you feel better and enhance a positive attitude towards your daily life. Always remember to eat and drink sensibly and don't smoke. Take one thing at a time and try not to get overwhelmed. When you do get overwhelmed, try to go back to the things that you loved before getting stressed. And if you need help dealing with the day-to-day stressors, or you have any questions, just make sure you reach out to your doctor or ask for help.
Some great points there, some action items to help reduce stress. Let's walk through it a little bit for your teenager. Exercise is key, and therefore getting involved in some sporting activities might be, but that also causes stress on its own. I remember because there's a tremendous amount of peer pressure with athletics. So they need to set aside time for exercise in a non-competitive environment, right?
Yes, and we have some teenagers out there who don't like exercise, don't like sports, and don't like those kind of activities. So you want to make sure that the exercise you do choose is something that you enjoy. So if it is that you have a teenager that enjoys baseball or soccer or something that's active like that, that's wonderful. Making sure that you limit it, that you're not overdoing it, that you give them an opportunity to take those breaks. If you have a teenager that doesn't enjoy that, perhaps there's something else that you guys could do together. So maybe they enjoy spending time with the family, so that you can do things like taking walks together. You can play games. You can get some glow-in-the-dark balls and go outside in the middle of the night and just play. Because sometimes it's about just getting active, just playing.
That sounds like a great idea. I might do that tonight. We have a graphic here that sort of walks us through some ideas on what stress is and how we should react to it. So anxiety or stress is a normal psychological and physical response to life's demands. So maybe first recognizing that it's normal will help reduce some stress.
Yes, absolutely. I think there's this perception out there that, to be the ideal person, you're supposed to feel great about everything, be able to manage, look good all the time. Stress is, just like it says, it's a normal part of life. Knowing that also alleviates some of that stress to know, hey, this is common, this is how I'm going to deal with it. How can I manage it so that it just flows in with everyday life? I'm not getting thrown off by it all the time.
Stress, of course, is a cue for our brain to go, fight or flight.
Right.
And we have to recognize that as well. We're talking about some ways of reducing it. Exercise is one way. Some other ways that can be reduced.
Some things that we suggest sometimes is because our bodies are responding to this stress response, helping your body calm down is really important. So doing things like meditations, doing things like visualizations, maybe even getting a massage, that helps a lot, because then your body starts to relax, and when your body relaxes, then your mind relaxes.
And taking notes, writing down. I mean, people don't write anymore. Kids don't write anymore. But it's not typing emails to everybody, but maybe taking the diary. That could help relieve stress.
My favorite thing to tell people is to do a brain dump. So literally take out a journal and dump your thoughts into it. Anything that you're thinking about, good, bad, or ugly, it doesn't matter. And then at the end of the night, I would say add some 3 things that were good about your day, something that you're grateful for, something that you're happy about, something that was positive about your day, so that you end on a good note.
And set realistic goals. Maybe if you start your day with 2 goals or something that you can accomplish easily.
Oh yeah, absolutely. You know, sometimes I have patients who come in and they have like a page list of things that they want to accomplish. And it's just too much, you know, exactly. Writing it down, maybe 2 each day. And then I just want to add on to the brain dump. You know, sometimes I'll have people write it on a piece of paper and just put it in a box so that it's literally in the box. I don't need to deal with it anymore. I'm here and now. So that's another way to cope with it.
Boys or girls, quickly, more or less, to end up in your office?
Boys or girls? That's a really good question. And by the look on our faces, you're guessing that we've got pretty much a pretty even mix. Honestly, I think it's pretty even. I think it's
opportunity.
Equal. Yeah.
Okay.
I think the manifestation might be a little bit different. A lot of times, you know, men are more comfortable with expressing maybe some irritability and anger. Not all of them, but it may be more present in that way, whereas women may experience it in a different way.
Okay.
So it's just different manifestations.
Grace and Amy, thank you so much. It's been a lot of very good conversation. That's it for today's show on the Health Channel. I'm Andrew Schmertz. Join us next time. Thank you.